Hi, I'm Karen. I'm gonna talk about the New England Journal of Medicine. The article is about the two phase 3 randomized controlled trials of ruxolitinib cream for vitiligo. Well, I would like to speak about vitiligo. Vitiligo is a chronic autoimmune disease that is causes skin depigmentation. A cream formulation of ruxolitinib, that inhibitor of James skins 1 and 2, result in repigmentation in a phase 2 trial involving adults with a vitiligo. We conduct two phase 3 double-blind controlled trials, topical ruxolitinib evolution in vitiligo study 1, 2v1 and 3v2 in North America and Europe that involved patients 12 years of age or older who had non-mental vitiligo with a depigmentation covering 10% or less of total body surface area. Patients were randomized in 2 or 1 radio to apply 1.5% ruxolitinib or controlled twice daily for 24 weeks to all vitiligo areas on the face and your body, after which all patients could apply 1.5% ruxolitinib drug week 52. The primary endpoint was a decreased improvement of the less 75% from baseline in the facial vitiligo area scoring index, range 0 to 3, with higher score indicating a greater area of facial depigmentation, or FVAS 175 response at week 24. There were 5 key secondary endpoints, including improved response of the vitiligo noticeability scale. Results: a total of 674 patients were enrolled, 330 in 2v1 and 344 in 2v2. In 2v1, the percentage of patients with FVAS I75 response at week 24 was 29.8%. In the ruxolitinib cream group and 7.4% in the vehicle group, relative risk 4.0, 95% confidence interval 1.9 to 8.4. In 2v2, the percentage were 3.9% and 11.4% respectively. Relative risk 2.7, 95%. The results for key secondary endpoints showed superiority of ruxolitinib cream over vehicle control. Among patients who applied ruxolitinib cream through 52 weeks, adverse events occurred in 54.8%, in true EV1 and 62.3%. In true V2, the most common adverse events were application site acne, 6.3% and 6.6% respectively. Nasophoric high 5.4% and 6.1%, and application site pruritus 5% and 5.3%. Discussion: these two phase 3 double-blind randomized controlled trials of repigmentation therapy in patients with vitiligo yielded similar results, showing spatial superiority of 1.5% ruxolitinib cream twice daily over vehicle cream for the primary and all key secondary endpoints at week 24, with approximately 1/3 of patients having an FVAS I75 response for facial repigmentation primary endpoint. The results for secondary endpoints were generally in the same direction as the results of the primary analysis. There was a numerical increase in the percentage of patients who meet the criteria for the primary and key secondary endpoints drug week 55, including among patients with crossover from Vicol to ruxolitinib for 28 weeks. However, no definite conclusions can be drawn from these results because of the lack of multiplication corrections. Efficacy at week 52 in patients who cross over to active treatment after 28 weeks of ruxolitinib cream was consistent with week 24 data in patients who applied ruxolitinib cream from day 1. These trials examined facial repigmentation as the primary endpoint and total body repigmentation as one of 5 key secondary endpoints. The repigmentation process is linked to JAK inhibition, with ruxolitinib cream reduces skin-associated inflammatory mediators CCXLC10 in circulation, disrupting vitiligo phonogenesis and allowing time for melanocyte recruitment and repigmentation. The lower in size of total body repigmentation than of facial repigmentation after 6 months of treatment, with approximately 20% of patients having a TBSI 50 response and 50% of patients having a FBASI 50 response. Is that the recognized difference in the nature of repigmentation of facial as compared with the non-facial body areas. The rate of non-facial repigmentation is further affected by involvement of the hands and the feet, with their typical resistance to repigmentation partly because of a lower density of hair follicles. Conclusions. In 2 phase 3 trials, application of ruxolitinib cream resulted in a greater repigmentation of vitiligo lesions than Vicol control drug 52 weeks, but it was associated with acne and pruritus. At the application site, larger and longer trials are required to determine the effect and safety of ruxolitinib cream in patients with vitiligo, funded by INCT through V1 and through V2 clinicaltrials.gov.